Hello, I'm John Lewis with the Association of Clinical Research Organizations. I'm joined today by Mary Woolley, President of Research America. Welcome, Mary.
Thanks, John. It's great to be with you.
I think you're very well known, certainly in Washington, for your advocacy efforts, but what would you like people to know about Research America?
Well, Research America is working on behalf of people all over the nation who themselves or someone in their family or someone close to them is suffering from a disease or disability that we don't have the answer for yet. And we don't have the answer because we haven't committed enough resources, especially research, to find out the causes and the better solutions, meaning cures and preventions for diseases and disabilities like Alzheimer's, Parkinson's, cancer, diabetes, autism, and so many things that plague us.
Mary, I know one of the big areas of focus for Research America is federal funding of research, and that's been there have been a lot of issues around that recently with the Sequester and with the current budget process or lack of a budget process. Can you address how that funding or uncertain funding affects the research process?
Well, actually, John, funding has been affecting research in a negative way for a whole decade now. There have been flat funding for the National Institutes of Health, for the FDA, for the Centers for Disease Control and Prevention. And what this has done is meant that we're kind of on cruise control for research almost at a time when the scientific opportunity couldn't be greater. Now, everything got a lot worse last year when Congress, in its wisdom, decided to implement an across-the-board cut of funding, and that's called the Sequester. And many people think it's just 1 year's worth of cuts and sort of a paper cut. But it's not like that at all. It's a 10-year law with cuts that are severe. Cuts that mean that every year there's cut on top of another cut. And we go from a situation not that long ago when 1 out of 3 of every research project that had been approved, that was already agreed that this was a good idea that we should explore, 1 out of 3 was possible to fund them. It went to 1 out of 6, and now it's projected to go to just 1 out of 10. It's almost a lottery kind of experience for researchers who've invested so much of their educational career and their time to finding answers to questions. And now they're increasingly being put out of work, literally.
And this is the basic research that the government conducts that hopefully translates into new medicines, that the pharmaceutical industry can pick up these discoveries, this research, and move it forward to bring it to people who need these treatments.
Right, that's exactly right. The federal government has for decades been funding, especially basic research, but also some clinical research and translational, but mostly basic, and with the whole point being that then industry picks up and reduces to practice, develops and reduces to practice to get to the product. It's a gold standard for the world that increasingly other countries now are using as their own standard. They're taking that playbook, the U.S. research playbook, and applying it in China, in Singapore, Japan, increasingly in India, Brazil, and more so in the United Kingdom and Germany, which used to be the powerhouse research countries, the way the United States has been for a couple of decades. So we're really worried about losing our ability to compete globally at a time when, as I say, the scientific opportunity has never been greater and the need on the part of patients is palpable.
If people want more information about Research America, research with the nice exclamation point in the middle, Research America, right. Where would they go to find that?
Well, Research America has a website, researchamerica.org, and another way to reach us is by social media with hashtag cures, not cuts. And we're encouraging everyone who's interested in this topic to get involved, ask about clinical trials, ask about research funding overall, and encourage the people you vote for to stand up for research. It's important.
And for more information about ACRO, please visit acrohealth.org and follow us on Twitter @ACROHealth.